doctors cut into the frontal lobes of the brain to treat mental illness. In 1949, one of them won the Nobel Prize in Medicine. Patients became calm, compliant, and cooperative. The committee called it a breakthrough. By then, tens of thousands had already been cut, quietly. State hospitals were collapsing. Wards built for hundreds now held thousands. Patients paced endlessly and screamed through the night. Sedatives wore off. Restraints did not scale. Administrators were not asking for healing. They were asking for quiet. Doctors traced agitation to the frontal lobe. They called it the seat of worry and the source of resistance. Sever the connections. Sever the suffering. The surgery took minutes. An incision above the eye. An instrument inserted. Connections severed. There was no complex equipment and no lengthy recovery. One doctor simplified it further by using an ice pick through the eye socket. He performed lobotomies in offices, in hotel rooms, and on children. Speed was the feature. After surgery, patients changed. They stopped fighting. They stopped speaking. They stopped being problems. They sat where they were placed. They ate when they were fed. They withdrew into compliance. Charts recorded improvement. Administrators breathed easier. Doctors called this recovery. The patients remained. The people did not. Some could not recognize their families. Some forgot their own names. Others sat in chairs for decades and needed to be fed, bathed, and repositioned. They were calm. They were also gone. Deaths were documented and accepted. Survivals were celebrated. No one measured what was missing. Journals published the results and training programs spread the technique. The procedure was not a secret. It was an export. Children received it. Housewives received it after husbands signed consent. Prisoners received it with no consent required. The institution had its answer. It was not going to ask better questions. In the 1950s, chlorpromazine arrived. Control without cutting, quiet without surgery. Lobotomies did not end in scandal. They ended in irrelevance. The procedure that won a Nobel Prize was no longer needed. There was no reckoning. There was no retraction. There was only a newer silence. The doctors were not monsters. They measured what they could see. Quieter wards. Compliant patients. Manageable institutions. That looked like progress. It was not cruelty. It was a measurement problem.